Dean of the Business School in Hasselt, Belgium. Our next speaker, please welcome him on the stage.
Thank you. You pronounce my last name like the famous American singer Bob Seger, so Segers. I'm Dean of PXL, University of Applied Sciences, and also affiliated to the University of Liège, where I did my PhD on the biopharmaceutical industry in Belgium. And I want to take that country study for Belgium as the core for this presentation, and try to explain to you how a mature industry, the biotechnology, biopharmaceutical industry, can connect to a startup ecosystem, an emerging startup ecosystem. So this is the information about me. It all starts with a regional system of innovation, of course, where you have all the organizations and all the players who are engaged in the innovation system. And that also connects fairly well to the triple helix framework, where you have business, government, and higher educational institutions working together. Biotechnology is, of course, very complex because you have a lot of players involved. You have the big pharmaceuticals, you have the startup companies, the new biotechnology firms. You have the very important role of the universities and university spin-offs. And you have, of course, the very important role of the financing organizations, because biotechnology, biopharmaceutical industry needs a lot of capital. So it's a very complex framework, as you can see in this slide. It's an industry with a long lead time. That means that it takes a lot of time before a product reaches the market. The focus of this study was on rat biotechnology. That means on medicines and on medical diagnostics. So it can take 10 to 13 years before a molecule becomes a saleable medicine. That means that you need a lot of capital. A lot of capital is burned, and there's a lot of cash burning going on. And you need, of course, to build on partnerships. So as the former speaker, Thorsten, and I'm a proud member of his organization also, was saying, you need a lot of engagement between industry and universities in this sector also. Very important, I must mention this, is the clustering, of course, because the clustering is very important. The framework, as I showed in the former slide, the clustering engagement is very important in this industry. As you can see, it all starts with the process of discovery. The drug discovery that is done in university spin-offs and in new biotechnology firms, in startups, in fact. And then you go through to the development, the production, and the marketing and the sales. And that is where the big pharmaceutical companies usually come into the framework. And there you see that a lot of strategic alliances, a lot of strategic partnerships are being built. And emergingly, the last decade, the open innovation activities. A lot of open innovation is happening. We heard a lot today already about patenting and the importance of patents. Patents are very important in the biopharmaceutical biotechnology industry, but they are not a holy grail, because you can have a lot of patents, but opening up your industry can also be important and is not against your patenting action. So let's look at Belgium. Belgium is a very important country in biopharmaceuticals. In R&D intensity, Belgium is even #1 in Europe. And that has to do with the fact that a lot of headquarters of big biopharmaceuticals are based in Belgium, and we also have two big pharmaceuticals ourselves, UCB in Brussels, and then Janssen Pharmaceuticals. Janssen is part of Johnson & Johnson, the American big pharma company. So a lot of R&D intensity in Belgium, and a lot of patenting also. If you compare it to other countries, depending on what frame you look at, Belgium is number 2 in market cap, has a lot of clinical trials going on in our country, and there are about 400 biotechnology companies in the country at this moment, 240 in the Flemish region and 160 in the Walloon region, and about 37,000 people are working in the industry. So we can say that the industry is very important. It's the most important industry for exports. What is very important are the 2 main drivers, and those are 2 cluster organizations that are very important for this industry. It's the Flemish Institute of Biotechnology in the Flemish region and BioWin in the Walloon region. So 2 cluster organizations that are doing tremendous work for this industry. The regional governments, they put in a lot of initiative that already started in the 1980s, and it's still going strong. So for 30 years now, regional governments in Belgium have done a lot of work in promoting and developing the biotechnology industry. In my PhD study, I did a follow-up of a number of biotechnology firms in Belgium, all of them stock exchange listed at the Brussels Stock Exchange. And what I found is that they are heavily engaged in strategic alliances with the big pharmaceuticals, the AstraZenecas of this world, the Johnson & Johnsons, the Mercks, the Sanofis, the Novo Nordisk. There's a lot of interaction going on between those new biotechnology firms and the big pharmaceuticals. So very important to take that into mind. A number of those companies, and in this slide, these companies are all stock exchange listed. They are into therapeutics, into cell therapy, or into diagnostics, and a number of them are already filing for market approval or are on the market as they go through the different phases in this industry. This slide, most of you will probably know. It's the famous Henry Chesbrough open innovation slide, and that is becoming more and more important in this industry, where you get your inside out and your outside in open innovation, bringing ideas from the outside into your industry and opening up what you have in your company to outside colleagues, even competitors sometimes. That's when you get co-opetition. The cooperative competition. So this is becoming more and more important. The choice for open innovation, as this slide shows, depends on the following: on the partnership building, but also on the co-creation. And the former speaker this morning was talking about patient engagement. So this is also very, very important, as the populations are becoming older and older. There is more need for new medicines and for good patient care. So they want to be engaged in what is happening. So there you get your customer centricity and your patient engagement. What is also new in this industry is opening up assets. For example, if you look at a big pharmaceutical, the #1 in the world, like Johnson & Johnson, they are now developing their J-Labs and J-Links campuses. Those are open campuses where they let researchers from all over come and work in their facilities, and they can exchange ideas and they can open up their ventures and see what comes out of it. So you get open labs, you get open IP, you even get public-private partnerships, like, for example, the IMI initiative. That's a European biopharmaceutical initiative. And then, of course, again, you get the importance of your ecosystem, of your regional innovation system. So when these four clusters come into connection, then you get the ideal situation, of course. Conclusions from this part of the presentation: Belgian biotechnology companies are mostly holding a nodal position. That means that they are preferred partners of big pharmaceutical companies. And a number of them are migrating into becoming a FIPCO. That means a fully integrated pharmaceutical company. That means that they will reach the market and put a medicine or a medical diagnostic on the market. This is again a conclusion slide, mostly into molecular diagnostics, into cell therapy, into women's health medicines, and into CAR-T genetics, so very important developments all over this industry. Even now we have breaking news because the last couple of weeks, two companies, Uplinks and Digenix, they are now involved in a merger and acquisition battle with Takeda and with Novo Nordisk, two big pharmaceuticals who are looking at taking over Uplinks and Digenix. I'm a shareholder of both companies, a small shareholder, so I'm looking forward to what is happening in the coming weeks. So now I come to the part where I want to connect that country study to an emerging startup ecosystem in my country. And I took the Limburg province. Belgium is divided into provinces. So I took the Limburg province, that's the region I live in. And there, a lot is happening. We had the shutdown of coal mines, the shutdown of an R&D facility by Philips, and also the shutdown of a Ford production plant. So there was a lot of people laid off in the last 20 years, but that unemployment was replaced by new high technology employment, by new startups. And this is the north of Belgium, this is Limburg. And Limburg is well connected with the south of the Netherlands, Eindhoven, where Philips is located, high-tech campus Eindhoven. It's also connected with Leuven, where KU Leuven is situated, and also IMEC, the Inter-University Microelectronics Center, very famous, world famous. Then in the south you have Liège, where the University of Liège is located, and of course you have Aachen, where RWTH Aachen is located. So within that, what we call the ELAT, the triangle between Eindhoven, Leuven, and Aachen. In that triangle, the Limburg region is located, and the regional governments they started a network of new incubators in our province, and from that network, a lot of new startups are now emerging. These incubators, there's one that is called BioVille, that's a life sciences incubator, so that connects to the biopharmaceutical industry. For example, there you see the new incubator, Corda Campus, that's an IT incubator, and this is an old coal mining facility where now a new incubator is also situated. So you see that all over the province, you see new incubators. And they are all involved in building strategic partnerships and in assembling connections between players within triple helix movements. And here is where the connection with biotechnology, biopharmaceuticals comes into the framework. You see that a number of startups in these incubators are now connecting with big pharma and with existing biotechnology companies. And I will give you some examples. EpiHunter, for example, that is a startup company that is located in this incubator. And EpiHunter is working on an epilepsy platform. But they are connected with the Belgian big pharmaceutical UCB, who is very strong in epilepsy medicines. So you see the connection between an emerging startup and a big pharmaceutical in Belgium. A second example is FibriCheck. That's a startup that is located on Corda campus here. And they are working on a cardiovascular app. And they are working together with BioVille, that's another incubator. but they are also working together with Blue Health Innovation Center. And Blue Health Innovation Center used to be called the Microsoft Innovation Center. So there again, you see a mature player working together with a startup. A third example is Ugentech. Ugentech is working on medical diagnostics. Their product is called FastFinder. And they are working together with Biocartis and with Fast Track Diagnostics. But Fast Track Diagnostics is a United States company that has a stake in Biocartis. And now you see that Ugentech, that is a startup company, is also working together with them. So again, you see that the new emerging startup ecosystem is coming into the framework of the mature industry already. A fourth example is Epitope. That's a Welsh and partly Belgian company. It's a bit more mature, but they are working on multiple sclerosis, and they are also located in the Bioville incubator. So again, you see in the region a lot of developments happening between mature and startup or emerging players. I also wanted to give you another example from a mature player. As I already told you, and I will go back in the presentation, we have the connection here with Brainport Eindhoven and Philips. And Philips you all know. Philips was very heavily engaged in consumer electronics. But that is over. Philips has now migrated into healthcare. And they have a new value proposition. That means that they are working for the next generation connected health. They want to be a data-driven company, a medical companion company. So again, they are looking to do good stuff for patient engagement, customer engagement. And they want to work and they want to connect big data and cloud technology for healthcare and for the health of populations. And they are also opening up their technology, so open innovation is also important for them. And now we see that Philips is also working together with startups in our province, again, within this environment, within this region. So I think these are a number of examples where you can see that emerging players, emerging startups are becoming very well connected with mature players. So the conclusion from this presentation, very simple. Emerging startups are slowly becoming scale-ups, and they are looking for mature strategic partners, as the examples were shown. And then the second conclusion is that on the other side, mature companies, they are co-innovating with emerging companies, with emerging startups who are becoming scale-ups. And you see a growing interest in open innovation. Thank you.
Thank you, Jean-Pierre. All right, it's time for questions. I know it's a huge responsibility to ask a question before the coffee break, but anyway.
Who is awake?
Who is awake? Oh, they are. Yeah, there's a bold person in the red shirt.
Hello.
Hello.
I have a question. What kind of innovations do you expect in medical industry? For example, robots making a diagnosis for patient, or what could it be?
The innovations are so immense. It's not only about biotechnology anymore, but it's about informatics, it's about nanotechnology, it's about artificial intelligence, it's about robotics. If you look at all the evolutions that are going on in genetics, in DNA sequencing, there's so much going on. So it's almost too much to follow up on. So yes, immensely.
What's your forecast about that gentleman's life expectancy? What do you think, considering all the innovations?
As he's looking now, 120.
120?
Yeah, why not?
That's it?
He should stay in Riga, of course.
Why?
Because it's good here.
It's good in terms of like air quality?
Life expectations, beautiful city, the
women.
weather, women,
yeah,
food.
All right. Yeah, sounds good. 120? Fine with you?
It's okay?
Yes.
Too much?
All right. Any more questions? Anybody willing to know his or her life expectancy? Okay, got this. Okay.
Thank you. Thank you for the presentation.
Thank you.
My name is Gatis Basbauers. I work here at RTU. You presented a very specific field, in my opinion, very specific field, biotech and medical applications. I would guess, but maybe you can show that I'm not correct, that making startup and in that field would require quite huge initial capital and a knowledge, and maybe there are many formal barriers. So is it more specific than any other fields? Is it more difficult to actually make startups in that environment?
In my opinion, this is for sure the most difficult industry to work in, yes. Because if you look at IT, the lead time is much shorter and you don't need that much capital. You can start an IT company, cloud-based, web-based. You can connect with Silicon Valley or with India, with Bangalore, very simple. You don't need huge capital. For example, if you have good engineers in this country and good people in IT, they are much cheaper than, for example, going to Silicon Valley and starting a company back there. I know the figures in Belgium. An IT person will have about 60,000 euros per annum. In Silicon Valley, that would be 200,000. So you don't need the big capital. But in this sector, yeah, you need a lot of capital rounds and a lot of venture capital, IPOs, initial public offerings, more extra capitals as you go through the evolution. So yeah, for sure, this is the most difficult one to start up. And that's why you get all those partnerships, of course, because at a certain moment in time, most of the time, the big pharma player will take over the small company. And if that doesn't happen, then the small company will go on its own and will become a FIPCO, will become a fully integrated company.